Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Sleeping sickness, it sounds almost peaceful, doesn't it? Like a deep, restful slumber, but the reality is far from serene. This serious disease, also known as African trypanosomiasis, wreaks havoc within the body, disrupting sleep and attacking the brain. It's a silent invader, often starting subtly before escalating into a life-threatening condition. This parasitic infection primarily affects sub-Saharan Africa. It thrives in rural areas where people live near tsetse flies, the carriers. With awareness, early detection and treatment, we can fight this disease. Understanding sleeping sickness empowers us to protect our health and support those affected. Sleeping sickness isn't contagious like the common cold. It's spread through the bite of an infected tsetse fly. These flies, found only in rural Africa, carry a parasite called Trypanosoma brucei. This tiny organism is the true culprit behind the disease. Imagine this. A tsetse fly, drawn to the warmth of your skin, lands on your arm. It pierces your skin with its sharp mouth parts, injecting saliva containing the trypanosome parasite into your bloodstream. You might feel a slight pinch, but often the bite itself is barely noticeable. Once inside your body, the parasite begins to multiply, traveling through your blood and lymph systems. The initial stages of infection might mimic a mild flu, with symptoms like fever, headaches, and joint pain. However, as the parasite multiplies and spreads, the disease progresses, wreaking havoc on your body's systems. It's crucial to understand that not all tsetse flies carry the parasite. However, in areas where sleeping sickness is prevalent, even a single bite can have devastating consequences. Therefore, prevention efforts often focus on controlling tsetse fly populations and minimizing human contact with these insects. Sleeping sickness is a master of disguise, often mimicking other illnesses in its early stages. This makes it tricky to diagnose, especially in areas where healthcare access is limited. However, understanding the common symptoms can be life-saving. Initially, you might experience flu-like symptoms. Fever, headaches, joint pain, and weakness. These symptoms, while uncomfortable, are often mistaken for other common ailments. This is where the danger lies. Without proper diagnosis and treatment, sleeping sickness can progress to its more serious stages. As the parasite invades the central nervous system, the symptoms become more neurological. Disrupted sleep patterns are a hallmark of the disease, hence its name. You might experience excessive daytime sleepiness, insomnia at night, or a complete reversal of your sleep-wake cycle. Other neurological symptoms can include confusion, difficulty concentrating, personality changes, seizures, and even paralysis. If you've been bitten by a tsetse fly or experienced these symptoms, especially after visiting an area where sleeping sickness is present, seek medical attention immediately. Section 4. Diagnosis. Unmasking the hidden threat. Diagnosing sleeping sickness is like solving a medical mystery. The parasite is cunning, hiding in the body and mimicking other diseases, but with the right tools and techniques, we can unmask this hidden threat. Early diagnosis is crucial. The sooner treatment begins, the better the chances of a full recovery. Doctors start by asking about your medical history, particularly any recent travel to areas where sleeping sickness is endemic. They'll also perform a physical exam, checking for swollen lymph nodes, a telltale sign of the disease. To confirm the diagnosis, a blood test is essential. This test looks for the presence of the trypanosome parasite in your blood. In some cases, a lumbar puncture, also known as a spinal tap, might be necessary. This procedure involves collecting a small amount of cerebrospinal fluid, the fluid that surrounds your brain and spinal cord, to check for the parasite. Diagnosing sleeping sickness requires vigilance and awareness. If you've been bitten by a tsetse fly or experience any symptoms, don't hesitate to seek medical attention. Early detection can be the difference between a full recovery and a life-altering illness. Section 5. Combating the Sandman, treatment and prevention. Sleeping sickness is treatable, especially when caught early. Medications target and kill the trypanosome parasite. Treatment involves hospitalization for close monitoring. Medication depends on the disease stage. Early stage uses pentamidine or suramin. These drugs kill parasites in blood and lymph. Late stage requires eflornithine or melosoprol. These drugs target the brain and cerebrospinal fluid. Prevention is better than cure. Simple measures reduce your risk. When traveling to affected areas, wear long-sleeved, light-colored clothing, as tsetse flies are attracted to dark colors. Use DEET repellent and sleep under insecticide-treated nets, especially during the day. UMCC, your ultimate medical consultant connectors.